October is Breast Cancer Awareness Month, and at Middlesex Health Cancer Center, the Comprehensive Breast Center is focusing on early detection. Here with the details is breast surgeon and Middlesex Health Cancer Center Medical Director, Dr. Andrea Malon. Doctor, thank you so much for being here.
Oh, you're very welcome.
So we're really focusing on the importance of an early detection.
Correct.
It could be a lifesaver.
Correct.
What should women be doing at home?
So at home is only a part of the process.
Okay.
So at home they can keep an eye on their breasts and report any suspicious findings to their practitioner. But really what's critical is for women to see their practitioner regularly, their doctor or their nurse or PA, and have their regular imaging done, most importantly, mammography.
And that should start typically at age 40?
Correct, right. So mammography is also supplemented with an ultrasound for certain people based on how dense their breast tissue is. And it usually starts at age 40, but it might start earlier depending on things such as family history.
And what are some of the breast cancer risks? You don't see a lot of them.
Right. So breast cancer, first of all, is the most common cancer in women, which means that all of us are at risk for it. And one of the things that gets people a bit confused is family history. If you have a family history, you are at higher risk than average. But even if you don't have a family history, you can still get breast cancer. And in fact, the majority of breast cancer is not genetic. It happens in women without a family history. So it's really important for everybody to see their doctor and get screened. And that's even more important if people are at high risk.
Sure. And I know at Middlesex you really focus on compassionate care. Explain to that what that means for our viewers.
So we really try to keep everything the personal touch. Everything from your initial evaluation and how you're assessed for what your risk level is. So risk can be increased because of your family history or other parts of your life. But also, once people have an abnormality, we have a very personalized approach to helping them get through all the necessary procedures, such as biopsies, referrals to other providers, and if needed, cancer treatment and care.
Sure. So if you are determined in that high-risk group, what are some of the extra procedures that you will go through?
So the most common thing if women are at high risk would be for them to have an MRI of the breasts once a year in addition to the mammogram. And those two tests look at the breast tissue slightly differently, so they complement each other.
Very good. Well, most importantly, where can we find some more information and find you?
So Middlesex Health has a great website, and if you go to the health website, there will be information how you can get your mammograms, how you can contact the breast clinic, and we'll be happy to help everybody.
Sure. And Dr. Malon, just a message you want to get out to our viewers.
It's important for everybody to get screened. Breast cancer is really common, and if it's found early, it's almost always curable, and that's the key. The people who have problems are the people who avoid getting screened, and by the time their cancer is found, it's much more advanced.
Sure. I mean, that's intimidating, but with compassionate care, you make it a little bit easier.
Dr. And we'll help everybody.
Very good. Thank you so much for being here, and of course, you can learn more over at middlesexhealth.org. Stay with us. More style coming up.